Swaziland generally as a country has a high burden of HIV disease, and this has affected each and every person in this country.
When we first started the project, there was little hope that these people will recover. But having gone with the project up until 2008, we have seen great improvement. Most of our patients have gone back to work.
Everyone wants a piece of Red Cross youth anyway.
As I'm working for Red Cross, it is actually motivating to me because the kind of service that we offer is comprehensive.
I do HIV counseling and testing. This was my dream come true ever since I discovered that I was HIV positive. I would love for the service to continue.
The program is consisted mainly of 4 main components. One is prevention, and the prevention is also targeting on one specific target group, the youth. Secondly, it is the wing home-based care, which I referred before. And then third, when the program started, it was so-called counseling and testing. It's also part of prevention, but not only. And then, of course, the big wing of treatment, including prevention to avoid the transmission of the virus from mother to child. Looking back and having the chance to be present on this program over a long period of years, I would summarize as follows. One is certainly that this program had the chance to develop itself organically. All the factors of time stress at that time was not so big as it is today. We are in Africa, we are on the rural side. Second, I think it has a very good cooperation with the other side, with our partners. We work very close to each other on the same level, and I think this is very, very important. It is not a dictate from one side. It is a real cooperation which has grown on. Also for our side, we learned a lot also from the understanding from the African side, from the Swazi side. The people on the ground, they know very well what could be the solution and where to go. But it requires that you go with them in the pace and in the pace that they give and not we want to have. And this is very essential. Then, of course, one of the main reasons, if we talk about the successes, if we can say so, is of course that the program is integrated. It follows the national guidelines with regard to HIV/AIDS from the Ministry of Health and governmental structure. This is very essential. And since in the beginning of that program, we tried to follow these lines. And today we can say we are a good supporter also of them because they use us as pilots. They use the Sigombeni approach to test it before they introduce it on a national level. The networking on the grassroots level, and the networking as such was a very important factor still today. When the program was growing on in the initial stages, there was no so-called delegate on the ground. Then the program developed itself, it became complex, more complex, and there was need to give technical support, and we have sent an experienced nurse with practical experience, but also with a certain experience in leadership. And I would consider this fact also as one of the main successes from our side. She had the ability and also somehow the talent to network locally together what should be brought together.
I'm Maria Katulu, the Swiss Red Cross delegate here in Swaziland, working since 4 years in this HIV/AIDS project. And it makes me to feel very good to work here.
We were very lucky to have with Dr. Martin Weber a very experienced and committed medical advisor for this program.
We could prove that it is possible on a high quality level to bring testing, counseling and ART therapy to the people. This is a great joy and satisfaction for me.
It makes me proud also to see that on the other side we also have a big continuity of staff. So the program designer of the Swazi Red Cross side was my colleague Elliot Jele, together with me. This was the starting point.
When I see all these things, and I feel so proud that the people of Switzerland, through the Red Cross, have supported us Bapalali to be very strong, both in terms of capacity and in terms of service delivery.
And of course there are many other persons very important from the operational side, are the site officer Chabum Tetwa from the Swazi Red Cross.
That is sort of motivating to me because I can actually see what is it that I'm doing.
It was Clifford Mwele, who is key in the youth program nowadays.
Because of the Swiss Red Cross support, we are having new membership and we are having partnership with other organizations because this is a wonderful program that we are doing here at Red Cross.
HIV/AIDS affects the whole society as such, and this is a real challenge. We are always stating there are 40% of HIV affected people directly, but we shouldn't forget there are 60% not affected, and we should talk also about them. Prevention, information, psychological support, this is very important also for the remaining people, not those only ill. And we should really shift this issue also more to this still hopeful target group for the future. It's the future generation. If we talk about orphans, that's why we have included this very important topic into the program. And with the treatment, this is a tool that you get people on treatment, they are the breadwinners of families. And these are all reasons, or maybe to mention one at the end, we here in Europe, we are talking from brain drain of health staff, from qualified health staff. These countries are losing so many health staffs going to Europe, supporting our health system here. Such programs, if you go a bit further, are a wonderful contribution for job ensurement locally, which is much more cost effective than to send them to Europe and send the money back. And then, of course, it has to do also with the job satisfaction of those people. And at the end, please let me state that very clearly, you make a practical experience, you show people what can be achieved. And I think this is very, very important for the future of society and for the people itself.